Welcome. Thank you.
Awesome. Thank you so much. Thank you guys so much for joining us tonight. Like, my name's Kyle Farr. I'm a board certified nurse practitioner. I'm outside of Metro Detroit. I'm super excited to be here tonight with Dr. Keller and Julie and to share with you guys all about NavaClick. I'm going to go ahead and step out of frame real quick here and get our PowerPoint up so we can jump in and start sharing why the three of us are absolutely obsessed with this nifty little tool. And we're going to remember the instructions. We're going to optimize for your viewing pleasure.
At least he has a nice Christmas tree we could all look at. That's nice.
It is.
I just have a snake plant. I'm not very festive.
Can you guys see that okay now?
Yeah, can you make it, yeah, there you go.
Okay. Let me get this out of the way. We're going to go to present, start from beginning. There we are. So Mel, when I say next, just there you go. So tonight we are going to have a little tox talk tonight, featuring the NavaClick syringe, and it is a privilege to be here along with Dr. Keller, and I think in our industry, it's safe to say the famous Julie Bass Kaplan is here tonight with us. It is always a pinch me moment when I get to work with her, so it's super exciting to be here tonight. And we're just here to kind of have like a really open-ended discussion. This is I think the three of us are very laid back. So at any time, if you have questions, please drop them in that Q&A there so we can get those questions answered for you and really try to make this as interactive as possible. Even though we want it to feel like we're in one room together, but really we're probably all across the country or maybe even in other countries if you happen to follow one of us on social media and you thought, hey, let's learn about this. So really kind of make it like we're together, and we'll try to integrate that in that way so we can have a nice night and really kind of learn about how the NavaClick syringe, just speaking for myself real quickly here, has really taken my tox game to the next level. One of the things I think Dr. Keller and Julie and myself all will agree on is, the aesthetic marketplace right now is so competitive. There are practitioners all over the place. Where my office is at, I could go for a walk and I can find 5 other places that are doing that. So I know one of the things myself is not just a business owner and a practitioner. I really want to make sure I'm differentiating myself, to really always being able to provide the highest quality treatment with the most predictable and safest outcome that I can with patients. And I know Dr. Keller and Julie especially, she's such an advocate and really a spearhead when it comes to safety with what we do. And when you start to adapt new technologies and tools like this with the NavaClick syringe, you're really going to bring your patient a safer, more effective, and predictable treatment time after time. And it's a lot more comfortable for them as well, which you're going to see here tonight. I also, just with me here, I want to give a quick thank you. I have Mel that works with me, who's kind of helping in the background, flipping our slides for us. And then Amanda is here as our live model tonight. So you're going to see Amanda have the click syringe. And I don't think, have you had the NavaClick syringe yet? She has had it before. She loves it. So she was back for more. I was hoping she hadn't. I couldn't remember if she'd had it or not, but I've been using them exclusively in my office now for quite a while. And so I know she's had it at her last treatment about 3 months ago. And so she can speak to tonight to really tell you a lot, the comfort that it brings to there. And then the quality of the interaction that I have with patients as well, because of the technology that they've put into the syringe, makes it where I can just spend so much more time focused on the patient. But Julie, Dr. Keller, anything you want to add before we jump in?
I would just say, the point of attaining patients and those kind of referrals, toxin is your first meeting most of the time when you get a new patient. That's your first chance to meet them. And if you blow it and you're not careful with your procedure and you don't spend the time getting it together and getting it right, you may lose that patient forever in your practice. And there's a lot of other things available to them. So it's your one opportunity. And NavaClick is extremely, extremely accurate, which is Julie's favorite part of it.
Yeah.
The precision, and it gives you a good treatment that's predictable, that you can reproduce.
Yeah, I met Howard about a year ago at the MAP meeting in Vegas, and I thought, oh, okay, I'll give it a try. And then once I tried it once, I was like, oh my goodness, this is so big. This is a big deal. And so I'm so grateful that Howard approached me and gave me a syringe to try, because it really has changed my tox game, and I just can't go back to the way I used to do it anymore. I feel like none of us are perfect, and that's why I just laugh when people say, oh, celebrity injector or famous injector. And it's all just, can I say a cuss word? But it's all just bullshit. So honestly, it is. We're all humans, right? We all freaking make mistakes. Like sometimes I'll be pushing along and the stupid plunger will stick, and it'll come out like a fire hose instead of a little garden hose. And then they get a crooked smile. And my point is, we're not perfect. So this helps us be more precise. This helps us be better each and every time, because it's hard to mess up when the device just clicks for you. So sorry, I already said the first bad word, but honestly, none of us are perfect, and we all just need to get over ourselves if we think we are.
No, I think that's so many valid points there. And, too, like what Dr. Keller said, and educating injectors, tox is kind of the gateway into a lot of our offices for these patients. And aesthetics is one of those very unique areas of medicine that we have to remember, that if a patient doesn't love their outcome here, they're more likely, I believe, to kind of just go somewhere else, to be like, well, maybe they saw me at first, they didn't like what I did, so they're just not even going to call me to give me an opportunity to check in on them necessarily. They might just go to Julie and be like, well, I was at Kyle's and this didn't work out, so what can you do to help me? So I think it's so important to really make sure when we have that patient in front of us, we're really delivering to them the best, most optimized and safest treatment that we can. And adapting tools like this in your clinical practice are really going to help take you that one step ahead of the competition. And your patients are going to love it. They're going to ask for it. And you'll be the coolest little clicker in town at the end of the session with it. So Mel, go ahead and jump forward there for us to our next slide.
Can I get a
And
t-shirt that says the coolest little clicker in town?
yes, we need some merch. So we'll get on the merch train next. And so these are just the three of us that are joining here tonight. Please, follow us on social media. We're all there to reach out and help you after this as well. If you have questions, you slide into the DMs and ask questions, ask about our experiences, how we've integrated this into our practice, how we got used to it, adapted it, introduced it to patients and our staff, and kind of helped really launch it successfully in the practice. That's what we're here for. And we're here ongoing for your support. It just doesn't end, here tonight. I know that's something that the three of us really all believe in. We're only as strong as the weakest one out there, and we've got to continue to help build each other up. And it's really a community, and that's how we need to be going forward. So don't ever hesitate to reach out. Go ahead and jump forward there, Mel, for us. So here it is. This is this novel solution, the NavaClick system. And this is what it looks like. I have one here with me tonight. You're going to see me use it on Amanda. The way it comes is it comes in these nifty little trays. You're going to get 4 NavaClick syringes, 4 of these 33 gauge ultra fine thin needles. This little sucker, you guys, I have patients that are actually like, did you even treat my forehead? Because they didn't feel the needle going in. They're questioning me. Did you even get that area? And I was like, yeah, we were talking and clicking so much, no pun intended, you didn't even feel the pokes, because this needle is amazing and it can truly hold up. I have used, a full face treatment on a patient might be close to 2 vials of tox on a patient, sometimes with patients. I have had that one syringe and that needle hold up for that full treatment because of the technology and the coating that's on that needle that really holds up nicely. It's not like your insulin syringes that we all used to use. I now am stuck with about 10 cases of insulin syringes just sitting in my storage, closet, because now that I have these, I can't imagine having them. I travel with them when I train out in the field. I have to bring NavaClick with me. I have, they're part of me now because they're so much what I use. You're also going to get 2 vial adapters in there. You're going to have the large vial adapter inside of the kit. That's going to go on your Botox vials, Jeuveau bottles, Xeomin vials, and so forth. And then that small vial adapter that will fit on your Daxify bottle, and it would fit on a Botox sample vial. These vial adapters allow needleless, drawing up of the medication. So you don't need to have another needle available to draw up your toxin into your syringe anymore. And then the syringes currently that are available with the NavaClick system, these are all 1 cc syringes with that proprietary click mechanism that's in there. And there's a way to engage it and unengage it when you want to withdraw your medication that you're going to inject. But again, what does this bring to your patient? It's that practice impact. It's kind of a wow moment for patients. Patients, if they didn't know what it is and they hadn't seen me in a few months, and now that I've switched to these, they're like, "What's that clicking noise? What are you doing? What's that?" And then when you kind of tell them why and what you're using, they're kind of like, "Whoa, I haven't heard of that before. That's kind of cool." They really can sense that you're doing that little bit extra to make sure that you're giving them that precise, predictable treatment. The practitioner experience. I'm a solo injector, you guys. I'm a single office. I have my assistant with me here every day, a receptionist. We have an esthetician who's caring about her day. And so I have to drop medication. I used to have 8, 10, 12, insulin syringes taken out in a room, and I'd have to label them out on a sheet of paper. And heaven forbid I shake that tray and not know what's where. With the dilution and how I can dose these, I can easily draw up a syringe of tox in 30 seconds and I'm in the room. So it's shortening my treatment time. It's giving me more meaningful time with the patient where I'm able to spend more time educating them and really kind of building that rapport and relationship with them. And then, like we've hit on already, that patient experience, the comfort level that they're going to have. They have that audible clicking noise. So for some people, it's a little bit of that auditory distraction. They may not need, maybe like the little buzzer anymore because now they can listen to the click. And quite honestly, the comfort level of it is so much better. They don't even really notice it that much. They might even question if you treated a certain area. Julie, Dr. Keller, anything else to add kind of about the system and how it comes and what you guys have noticed?
It just
Go ahead.
saves a whole lot of time with withdrawal. I mean, sitting there waiting, pulling up all those syringes, storing them. I keep a small fridge in my exam room, and I keep my mixed toxin there, so I don't even leave the room anymore to go to the fridge in the back. So it just sits right there. I pull it up right there in front of the patient. They see I'm getting exactly what they're going to get, and there's no walking back and forth.
Yeah,
Yeah.
and I really I love that you can put a whole vial in a 1 cc syringe, this one syringe if it's a 1 ml dilution. I can't wait for the 1 ml syringe to come out. I know it's on the horizon, but right now I'm using a 1 ml dilution in these, and so every click is 2 units. So most of my patients get a whole vial, or they'll get a half a vial, but it's just so easy to do. If it's a 2 ml dilution that I want, then every click is a unit, and it's just easy math. It's easy for my brain. And like you said, you can spend more time connecting with your patient or clicking with your patient, and less with all the math. You just draw it up, you know what it is, and you start, doing your art. So I just love the ease of it. And patients absolutely love that every time they hear a click, they're getting 1 unit or sometimes 2 of what I'm using.
Yeah, it's a fantastic system, that time saver that's in there. I mean, you guys, especially a lot of the nurses that I connect with, my newer injectors, I tend to train a lot of new injectors. And one of the things that I've been using NavaClick even at my novice classes that I have sometimes, and I don't have to pull out the dummy vial of tox and an insulin syringe and say, okay, for the next 20 minutes, I just want you guys to practice drawing up toxin into an insulin syringe because nothing is going to frustrate you more than having to learn how to do that for the first time, because the ease of this drawing up is so straightforward, so fluid, and it just so quickly speeds up that time. And that's just valuable time that we can connect with our patients, build those meaningful relationships, but then still also keep our treatment times tighter so we can have a more economical practice. Go ahead and jump forward there for me, Mel, to our next slide. So this is that nifty little syringe that we've been talking about here. You're going to have that audible and tactile feedback where you're going to be able to hear that clicking. Julie's favorite part here, that precision dosing and charting. We're going to show you tonight the charting system, and Laneige has a whole plethora of resources, you guys, that are available on their website. If you've spoken to a rep, you might be able to pick up one of these books, or if you're at a conference out there, there's some QR codes on there. I'm happy to post the links on social later, but and they're linked on Laneige's website as well. But there's dosing charts. I'm bad at math. I'm horrible at math. I'm really, really good at aesthetic injecting, horrible at math.
Yeah.
But I can download dilution charts where I know, okay, if I do one click, X number of units, we're off to the races. I don't have to have these mathematical equations where I feel like whenever somebody's talking about tox dosing and dilution, it's like that scene in Mean Girls where she's like, whatever, I'm getting cheese fries, and you're just, because you can't figure out the math. You can't figure out the units. And this Laneige has simplified this process so much for us, so we can be so much more effective, and we can look at these dilution charts ahead of time, find the one that based on the tox that we're using, whether it's Dysport, Botox, Jeuveau, Daxify, we're able to very simplify, find the dilution that's going to work best for us, clinically makes sense based on diffusion into the tissue, and we'll work with our clinical practice. That work is done for you, and it's very easily available in a downloadable PDF that you can just slap on your work counter and look at it every day. We're going to have that reduced waste. So we have less waste in neurotoxin because of the dead space. These are, dead space free syringes. You're not going to have extra coming out. Less landfill waste because we're not throwing away extra needles and sharps and things of that nature. And then again, that improved patient experience. They have more comfort, more time with them. Again, I think we need to run with this where you get to click with them more because of NavaClick. You're going to have more of that patient provider time where you can really talk and build that relationship with them, because that is one of the things that I've fallen in love with the most in aesthetic medicine, is that relationship that we have with our patients. We are their unlicensed therapist. We are their friend. We are their kind of everything. And you're going to have more time now because you have more patient provider time. Anything else from you guys on that with this, with the NavaClick syringe?
Can I just say that I live on the West Coast. I know I have a California accent. I can't help it, but I say NavaClick, and I also say Lineage. So
Lineage.
yeah, Lineage, and I say NavaClick. So and I know Carla and Howard are on the East Coast. So I want to know if I'm way off base in how I say this.
NavaClick.
In the
Dr. Keller.
in the South, we say NavaClick and Lineage.
NavaClick. Okay.
And
I'm probably that
how do you say Lineage?
Michigan accent where we say
Lineage.
everything funny. We say, NavaClick. I'm bad at pronunciations. I'm horrible at it. But go ahead and jump forward there for us, Mel. And so kind of bringing value to practice. I want us each to kind of talk about what we feel has really kind of brought the most value to us. And I kind of already hit on this. I don't need to expand on it more, but it really reduces my prep time and treatment time with the patients. I can audibly hear the clicks that I'm delivering. Like Julie, I like to use a 1-to-1 or a 2-to-1 dilution based on the toxin I'm using. And I just know that every click is 1 or 2 units. So I can be talking to the patient about their day, what's going on. I don't have to look at my syringe. I can look at the patient. I can look at, something else, but I don't have to follow that syringe to make sure that I get just to 5 insulin units or something. I can literally just listen to my clicks and I know that I've delivered that dose. I get that. So my treatment time has really shortened, and my prep time. I'm now literally going to be like, hey, I'll be right back in a couple seconds. I walk out of the room. I draw up that 100 units if I'm doing a 1-to-1 or 50 units if I'm doing a 2-to-1. I put it in the syringe and I'm back in the room in honestly about 30 seconds. And I have so much more time with the patient where we can connect and engage on a personal level, but also from a business standpoint. You can talk to them about other services, other treatments that they would benefit from, help them build that care plan, educate them more. This is all more time with the patient, which is really going to build a more economical and prosperous practice for yourself as a practitioner.
So I'll just say that we actually were, of course, the first practice to initiate it back when we launched last year. And so I noticed over the first 6 months that we were seeing less people come back with, a spiked brow, a little asymmetry or something like that. So I actually ran our data. And in 2023, with the same period in the calendar, we had a 4.52% touch up. Now, touch ups to me are when they come in less than a month with an asymmetry, not under treatment because they didn't let you use enough toxin that day because they were on a budget. So if it's a needed more, that didn't count as a touch up. But then I reran the data after we initiated 100% NavaClick, and that went down to 2%. So a 50% reduction. And then there's a couple of other practitioners that have gone 100% NavaClick as well, have also seen at least 50% or more reduction in touch-up rates. And that's usually free toxin that you're giving away, time in your chair, an appointment you could have had a new patient in. So that's a savings for the practice, more money. And then the other thing I will say, Kyle touched on it, the clicking. I told them the other night when we were practicing this, I'm 59 years old. I can't see the lines on those little syringes anymore, even with my readers. So it's a delight that I don't have to see them. I can watch where my needle is, exactly my position, and just listen for what I'm injecting.
Yeah, I'm only 2 years behind you, Doc, and I have the same issues.
And you're already a grandma.
I'm
How's
already
that?
a grandma
I'm jealous.
because my children are very prolific. Yeah.
Okay.
No, I only have 2 kids with kids, so I've got 3 more that could happen. You never know. But yeah, I think that precision is the biggest one for me because, like somebody said earlier, if you just meet them and give them a crooked smile or a wonky brow or crossed eyes or a plethora of things that can happen, and you just had a thumb twitch that day or the barrel stuck or you didn't pay attention, you looked up when you were pushing and all it takes is that extra pressure, that extra pushing too hard for it to go to a different muscle that you didn't want to get. So I feel like I think it is way more precise than the way I used to do it. And it's precision is a big deal. And Kyle mentioned earlier how we don't have a lot of room to mess up anymore because there's so many places everywhere. And some people might, because they feel like they need to or want to go for the cheapest place, but also that has consequences if they don't have any education and they don't really know what they're doing. So I think we really do need to set ourselves up as somebody who cares about precision and spends a little extra time to learn other new techniques and safety, and who spends a little extra money on getting the best things for their patients. I think that shines through really. And I don't mind spending a little extra money because I know I'm saving money in patient retention and time and in excellence of the procedure.
Yeah, absolutely. And those are all things too. Like I said, I'm horrible at math, but I know I've noticed since really fully bringing these on over the last 3 to 4 months, my little touch-up visits are really next to none now because I'm getting like what Julie hit on, that precision of the treatment and really getting a solid result. And especially if you're a newer injector or newer into the industry, adapting something like this, the ergonomics of learning how to hold an insulin syringe and have your thumb near the plunger. And I joke when I train, but sometimes a little bit will dribble out and I'm like, $5, $5, $5 with each drop. You don't get that because you have that click mechanism in here and you have to have that tactile clicking. So again, extra product waste, things like that, that's going to happen. We're really helping reduce all of that. And like what Julie hit on there is so important. You're going to spend a little bit, but you're going to save in compound in the end when you look at the end result by delivering them a better treatment and a better outcome. It's probably the similar thing that happened when cannulas kind of first hit the market 10, 15 years ago. Everybody was like, whoa, these are expensive. That this is going to cost extra to my treatment. But look at where we're at now. We can get, based on some research, a safer, more comfortable treatment for the patient. Yes, we're spending a little bit, but we're probably saving in the long run with retention, patient experience, things like that. Go ahead and jump forward there, Mel, for us. And this is that audible and tactile feedback. So we're going to get that very precise with each click right now with the blue syringe that's currently out available for purchase. You're going to get that 0.02 ml click. And like Julie kind of dangled the carrot on or teased, you know, there could be some other things coming down the pipeline of different click amounts and so forth. But right now, based on then, and you don't have to worry about, oh, geez, 0.02 mLs and how many units are in the vial in this. Guys, this is like foolproof. You can download dilution charts that literally have, and some of them are in the little booklet that they have at NavaClick. But there's, you know, just these little dilution charts that'll tell you, okay, one click at a 1 cc reconstitution is this many units. One click at a 1.5 is this, and so forth. It's foolproof. It's in your pocket. You could take a picture of it and have it on your phone in a photo album. You can print it, have it on your countertop. I mean, that is really what you're going to get. So as a practitioner, I love that audible click. I just listen, 4 clicks, and I know I've delivered, if I'm using Daxify that day, my 8 units of Daxi. If I'm doing a 2-to-1 of Jeuveau, I know that I've delivered 4 units in that spot. I just listen for the clicks, and I don't have to watch my syringe. And I know, Julie, we probably all had this happen when we used to use insulin syringes and Dr. Keller 1,000 times a day. It felt like where you'd put the needle in and you forgot to look at the barrel of the syringe to make sure that the dash marks were facing you the right way, or so you could see how much you were pushing. That doesn't matter anymore because we're listening for clicks. And as soon as you have that simple, how many units per click in your head, it's very easy to dose and map out that tox. Anything else, guys, on that clicking?
Somebody asks a good question. Karen asked, if you do intradermal injections really superficially, like for example, the tail of the corrugator, where you don't want to go deeper than the dermis, is it still doable? I say yes, it absolutely is. I do a lot of those intradermal injections, especially for microtoxin, for rosacea, or neck crepiness or something, and also tail of the corrugators. I wait 2 or 3 seconds before I pull the needle out, because I wait until it looks like a great big whitehead pimple, all blanched and all like fully engorged white tick, maybe, if you will. But I make sure it's nice and bright and white, and that circle is all the way there and full. 2-3 seconds, and then I come out, and then there's no waste. But it does take a little extra time, but I feel like it's worth it to me, because of that precision.
Yeah, absolutely. I would say, yeah, you can, that your depth that you want to be able to work at, none of that's going to change. And actually, it's probably going to be a little bit more comfortable. And because of the engineering and the design behind that needle that's in there, it's going to be a lot more comfortable for the patient. It's a 33 gauge versus what you may be using if you're using insulin syringes, whether it be a 31 or a 29. You're going to have a lot more comfort there for your patient. But Julie, I do the exact same thing, like what you said. I just wait a couple extra seconds there to make sure that everything looks big. I love your descriptions, like that big whitehead pimple, to really make sure that you see that kind of blanching of the tissue there. And there's no waste, no dripping from that.
You just got to be patient.
Yeah.
Somebody asked if it exists in Canada. Can they ship to Canada or any other part of the world other than the United States? Does anybody know that?
Not at this time.
But maybe someday.
Hopefully.
Cool.
Cool. Dr. Keller, anything on the audible tactile that you like?
I said that earlier. I don't have to see it anymore. I can hear it. So it's just great.
Yeah.
Yeah.
It's awesome. All right, go ahead and jump forward there for us, Mel. So this is that whole reduced neurotoxin waste and that patient comfort we talked about. This is that low dead space syringe and needle. So again, if you look at kind of the red there being the waste versus looking at maybe a standard syringe and a standard needle, or you'd have that low, what we typically know as a low dead space syringe with a standard needle, you still have waste there in the hub of that needle. And then with the NavaClick system there in place, it's really just that minute amount that would be in that 33 gauge needle barrel that's going to be left at the end of the treatment. So you truly have no waste. And waste too, lack of waste from especially the small adapter on like a vial of Daxify. I mean, that vial, when I fill up at a 1-to-1 dilution, I don't have really a drop left in that vial. It fully fills that syringe. Those adapters are so clever and so slick, and you're able to really kind of quickly draw up. And so we've really minimized using this a lot of waste that's really just those first two pictures there, that's just money that you're throwing in your sharps container at the end of the day. And that adds up. Think about when you're doing a lot of volume, you're doing 10, 15, 20 vials of tox a day, multiple syringes. How much of that adds up at the end of the day? And how many treatments could that have been into patients, which is really money into your practice?
You know what, Kyle? I still take the cap off and get a long skinny needle and dredge out the dredges.
Oh, I
And
do too. At the end of the day, I
probably
save up
because,
and
yeah,
yeah.
it's probably because I grew up poor, but you know, every little drop matters, man. So some people might throw it away, but those are the people that got cars on their 16th birthday, I'm pretty sure.
No, I'm with you, Julie. At the end of the day, I go through my 10, 12, 15 miles on the counter and I dry those things bone dry. And that's the, you keep those in the refrigerator, and at the end of the day, I condense them all down and make sure I save that
Yeah,
very last drop. But
so do I.
you're not throwing just extra tox into the garbage like you are with, your old way of using a standard syringe and standard needle. And even some of your insulin syringes, they have a lot of waste in them. And also I remind injectors, insulin syringes, they're made to use once. They're made to poke once
Adult.
and then throw in the garbage. They're not meant or into a sharps container. Don't do the garbage. OSHA will come knocking. But they're meant to be used single use. They're not meant for 5, 6, 7, 8, 10 pokes into a patient. That needle dulls very quickly. It becomes very uncomfortable for the patient. You kind of have to force it in, things like that. This needle is so much more well designed for that patient comfort. And go ahead and skip forward there for us, Mel. So this is that facial mapping system that NavaClick has designed for us. And this is such a slick tool. I have started to use this on my patients. This is key. You're able to scan this maybe potentially into your chart. So say Julie and I are working together in the same clinic. I treated somebody and then maybe I'm out. I'm on vacation. I'm sick. We still want to get our patients in. We still want to get them treated. If you utilize these facial mapping sheets and you record whether you did dermal, muscular, superficial, what dilution you used, and how many clicks you did, Julie could look at this sheet and duplicate my treatment or vice versa. So we're able to deliver the same treatment. And it's no longer where you're just writing like the old school way. You might have just written, 12 units with a line across the 4. I think about how I used to chart versus how these tools have really pushed me to be a better clinician and really record. So I can be like, oh, okay, Dr. Keller's in the clinic today. This is what I did last time. Hey, Dr. Keller, how was that? Oh, it was amazing. Great. I've got my recipe card. I'm ready to go. I'm going to get the exact same thing, every single time. Why does Chick-fil-A taste so good? They use the same recipe every single time they make that chicken sandwich. You have those tools here now to make sure you're getting those same predictable results. And again, they're easy to replicate. If you work in a multi-injector clinic, where maybe patients aren't necessarily dedicated to one practitioner or the other, using tools like this really makes sure that you're delivering those solid same results to your patients. Guys, anything to add about that facial mapping tool?
I'll just say it's one of my favorite things because I do have 2 other injectors that inject behind me. And the other thing I like about it is patients really enjoy when you pull that thing down, when you're doing their initial first time you've ever seen them, and you go through their muscle movement and you chart on there how many units you're going to put in different places. They get into that. That means something to them. That means that you're thinking about it. It's not just rote. You're taking your time. You're thinking of them specifically and formulating a plan for them. And it really is a solidifying patient practitioner moment. And then the reproducibility, if they come back and I always say, how do we do last time? And if they have any issues at all, you know exactly what you did and you can tweak it or whatever you need to do until you get it just exactly right.
Yeah, and there's 2 forms you can download, like the paper one, or NavaClick will send you like a laminated one if you want to write on it with like an expo marker. And then maybe if your charting system allows you to just take a picture of it and then add that to their chart, or if you scan these in as a PDF at the end of the day. But it's this tool alone as muscle. It's a great education tool to pull out with your patient and explain to them, why maybe aren't they the best candidate for a bunch of frontalis toxin? Because they think if you put toxin up here, it's going to lift their brows. You can show them, look, there's only one muscle up there that's a levator muscle. You can show them these muscles that you want to treat and how they interdigitate with each other on the face and affect facial movement. So I think as much education as we can give patients that shows them like this, again, it just elevates yourself as a practitioner to the patient that you're really taking these extra steps and these extra moments. And because of the time you're saving drawing up the medication, you're going to have those couple extra minutes, especially on those initial consultations and visits, to use tools like this to kind of empower them to have a little bit more good knowledge instead of, Dr. Google knowledge that they may find, but you can give them your controlled knowledge and education and advice on why you want their treatment to be done the way that you want it to be done. Julie, anything on facial mapping that you like to add in, or any key
Yeah.
pearls or tips?
I like to use this chart, but I also like to color the muscles that we don't want to get in blue, so that, and then that's what I laminate. So I don't have it with me, but I took a blue pen or highlighter, and highlighted all of the muscles that we can accidentally get, and talk to them about why precision is so important. That way they're less likely to go cheat on you if they know every one of these muscles and why you don't want to get it and what it could cause. So I do a fair amount of extensive education to each new patient, especially so they understand, hey, this is a big deal. Precision is a big deal. And depth. What depth are you going to put it in? This is why, the DLI gets hit so often, is people are going so low and going too deep, and it's going to get it. They lay on top of each other down here. So I tell my patients that all the time. So if it does happen, then they'll know I tried my hardest. I mean, and
Right.
so yeah.
It's a great tool. I highly recommend when you implement NavaClick into your practice, spend the time to do this. You're going to have that little bit of extra time because drawing up the talks is so much quicker. And when you implement these, you're gonna really separate yourself as a practitioner in front of your patient, and really kind of impress them with your knowledge and education there. Go ahead and skip forward there for us, Mel. So we're going to jump now to the live patient demo. I'm going to swing the camera around to Amanda here, and I'm going to, I think, temporarily stop sharing the screen. All right. Guys can still hear me good, right?
Can you make your screen really big so we're really small and we can just see?
Can you guys hear me okay still?
Yeah.
Yep.
Okay, perfect. All right. Somehow when I stopped sharing, everything went on mute for a hot second. So, and then how do I pin myself to be the main?
Oh, I think speaker view. We all have to go in speaker view.
Okay. Oh, geez. Well, I don't know how to, I'm just going to leave it as is because here, view up here. There we go. I am on speaker view, but I'm seeing Julie in the center, which is fine with me because
You're in the big picture for me.
okay. I'm in the big picture. Okay. I'm good. If Julie's on the big view for me, that's wonderful.
I just did it. I switch you.
Okay. Thank you.
You're welcome.
So we have Amanda here. She is our beautiful patient who's joining us here tonight. She's a good friend of mine and best friend of my assistant, Rachel, who's with us here at the office. And Amanda loves her neurotoxin. And she's had NavaClick before. Did you notice a difference when we used it that first time, comfort-wise at least?
Comfort-wise, absolutely.
Yeah.
And then also the ability just to converse with you. You
Yeah.
were more engaged with me as far as, what you were doing and more focused on me rather than what you're doing.
Yeah. So if my mic wasn't picking it up, she was saying we're just a lot more to be engaged and focused on her, which I think is really so much more beneficial because these visits, at least in my clinic, they're 15, 20-minute visits. I want to maximize and optimize that time that I'm with the patient so they really get that value with me and they get that one-on-one time and they feel that 10, 15, 20 minutes was a half hour, 45 minutes. I'm able to talk to them about their life, their family, skincare questions, things like that. That's so much more valuable. So I'm going to show you here now. I'm going to zoom in a little bit on Amanda, which I know she'll probably love. So we have Amanda there. And then I'm going to kind of show you here too. I'm going to hold it there in front of her, but I'm going to show you kind of the joy of the NavaClick system and how this works if I were to kind of treat Amanda. So I have kind of here, I'm going to hold it in front of there. We have our NavaClick pack that comes up. So I would open this pack, and like I said, there's 4 syringes in here. So based on, a patient, using these, I could use this maybe on, 2 patients, might treat them, things like that. But I have 4 needles, 2 vial adapters. I will tell you guys, these vial adapters, you can switch them between vials. It stays aseptic technique there. And so I'm able to save those, but then after a couple uses of vials, they're able to get tossed, and then you get a new one in each kit. So it's really, really nice to have that there. So then the next thing I do is I just kind of choose, what tox I'm going to do. So initially I'll kind of show you what mine might look like in my clinic. So if this was one that was in my fridge, from earlier today, we have a vial. This is just a vial of Jeuveau. And then I can also show you the Daxify that's on here. So just those vial toppers that go on there, those adapters for drawing it up. And this is how they're able to stay, in the refrigerator, in the room, or in your med room for use when they're there. So it's very quick to draw up medication. But what I want to show you guys first is just a little kind of how I assess the patient and educate them, and do a little bit of tox mapping on them per se, to kind of explain why we do things. So Amanda's kind of we were talking before she got in here today, or when she got here, she's about 3 months out from her last neuromodulator treatment, right? She likes to be, she likes to stay pretty nice and tight. She works in a stressful banking job, and so she likes to kind of hide that WTF face as much as possible when working with the general public. So, and it just kind of keeps her refreshed and rejuvenated, and it feels good. So youthful. So when she comes in, we're going to treat today, just for simplicity of treatment and demo. I'm going to focus on Amanda's upper third. I am happy to answer questions or shoot us messages later on if you have questions about other areas and things like that. But my depth and my technique really doesn't change too much. It's just more of that patient interaction and how quick and easy it is. So when Amanda were to come in, I'd kind of always initially say, wipe your makeup off, come in with a clean face, which she did. And then I would just kind of prep them with some alcohol, just to kind of cleanse that skin, or whatever your aseptic cleaning product of choice is, whether it's Purison or alcohol swabs, whatever you like to use. And then I love to use expo markers when I'm marking on patients, to kind of put my dots on their face. Just when you wipe them off, don't wipe them off with alcohol, because it will smear it. But if you just wipe it off with Purison at the end of their treatment and kind of cleanse their face, those little expo marker dots come right off, and they're good to go.
Oh my gosh, Kyle, I didn't know that. I did not know that. Thank you.
Yeah.
I turned my son green once in front of live TV.
They're alcohol based, I guess. So like they dry and kind of leave that film, and it wipes off much easier with Purison or water. But
God, thank you.
I still to this day draw on everybody. I think it's best clinical practice, you guys, to still draw on all of your patients. Show them that you're taking that step. Map them out at every single visit. I've had patients come in, and they might be new to me, and they're like, well, I heard from my friend you've been doing this for so long and you're still drawing on me. And I'm like, well, yeah, I draw on everybody. I got to have a plan. I'd get really nervous if I went in to see Dr. Keller for surgery and I didn't have any marks on me, or where he was going to maybe cut my tummy tuck or do something like that. I'd if he's like, oh, we're just going to wing it today and see how things line up. Yeah. Well, this is medicine, guys. We've got to have this plan. We've got to have this map that we're going to follow. So if you're not marking because you think, oh, I've done this so long, I can do this, get back to marking, draw that plan out. It's going to really keep you in a much better, more focused, practitioner. So when Amanda comes in, what I would do is I'd kind of have her go through movements, talk about, how was your last treatment? Worked well on you, I would say. Not I would have heard about it, so it was good, gave her a really solid result. And so then I just kind of go through the motions of these upper 3 areas that we're going to treat. So Amanda, go ahead and squint tight there for me. Really good. So I see she's really where I would love to have her at that 3-month mark. She's just on that come down of her tox kind of wearing off. I'm able to kind of really see, I like to do what I like to call an optimized glabellar placement. So you'll notice really one thing too, anatomically, a little tip here for you. Get yourself to one of, a cadaver course out there, whether it's, Empire, or if you get the privilege to go out to Julie and spend, time with her, get to a cadaver course so you can really see where these muscles originate at. Where's the origination of the muscle? Where's the insertion point of the muscle into tissue? you really want to make sure a majority of our tox dose needs to be at that origination. That's the strongest area of pull on a muscle. So especially with that procerus muscle here, its origination truthfully is a little bit lower in that procerus muscle. So we want to kind of almost be medial, between her eyes. And if you look at every, package insert that comes out there, you're going to see that dose higher in that glabellar complex. I can't talk today. And then again, optimizing that tox treatment. Again, go ahead and relax there for me, Amanda. I can kind of isolate between my fingers her corrugator muscle there. I can feel that belly of that muscle there. Again, its origination is tighter here, more centrally located. It might almost feel like on Amanda, I might even go, kind of right near where her brow is at there. But again, that muscle originates on bone medially, and then that muscle kind of takes off like an airplane and inserts into soft tissue. So kind of what Julie was talking about earlier, squint tight for me. She doesn't have a ton of pull over here. So I want to be very almost dermal on my second injection and making sure that I'm especially want to stay dermal and avoiding more centrally located there, because one of the things we're trying to avoid, and I'm going to grab my skull here to kind of show the biggest cause I feel, Julie, chime in if you think different, when you get a lid ptosis, it's because tox is able to kind of track down this supraorbital foramen, and that we know that nerve really innervates with that levator palpebrae, and it kind of wicks down there per se. Kind of if you think about elementary school where you took one color of food coloring and then wicked it over to something else, tox will kind of track down that. So it's because you got your needle too deep. I said
Don't get your
noodle. I don't know
noodle
where-
too
your
deep,
noodle.
Kyle.
Yes,
Not your
you don't-
noodle.
Yeah, not your noodle. That's a whole other webinar.
That's a whole different
Different
problem.
channel. Yeah, that's a whole other day. But you want to make sure that you stay dermal there. So we're isolating just those muscles. Guys, we've all had them. I've had a lid ptosis, and I think we've all had them. It's not a fun, little bit to talk your patient through, and it's going to happen. It's not a matter of if, it's when. But again, using tools like this, we're going to be so much more precise, much more meaningful with our treatments. And then go ahead and raise your eyebrows for me. Again, Amanda's really good at coming to see me every 3 months. I'm going to look at her horizontal wrinkle pattern in her forehead. She really doesn't have much wave to it. So I know that she has a strong central pillar. Patients that have wave to their wrinkles on their forehead, that means that they have even maybe a bifurcation, kind of similar to what you might see on that tox mapping sheet. So if they have a bifurcated frontalis muscle there, these patients, according to some research, they're most at risk for medial brow ptosis. My husband is one of those people. He has a real rippled forehead wrinkle. I have to be very careful when I'm doing Dan that I really make sure that I treat and I nail his glabellar complex, because these patients are highest risk for dropping that medial brow where they're going to feel like they're heavy in the middle there. Amanda really doesn't have that. I just need to give her a nice, traditional treatment there just to kind of tighten her up. I've treated her several times. I know it works well for her. Raise your eyebrows for me and kind of hold there. So I'm going to draw out my kind of pattern here. And again, I'm going to use on her today, I'm going to use, can show you guys either Jeuveau or Daxify. We can take a poll there and you let me know. Drop it in the Q&A what you want to see, and I'll use that one. And we won't, we'll be equal here. But based on my dosing, if I was doing Daxify, I'd probably give her 40 units in her glabellar complex. I know when Amanda starts to come onto that movement, it tends to kind of come back pretty quick. So I want to tighten her back up. Plus the treatment's complimentary today. So we're just going to make sure we give her the good one. So at her family holiday parties, we don't have any, her face doesn't have subtitles. We'll make sure we knock that out. We'll do her a favor with the family. And then again, on the forehead here, if I was doing, Jeuveau, I'd probably do 2 units per injection site on this upper row of tox there. Again, this is the origination of the frontalis muscle is near the hairline, and then it inserts lower on the face. So then my under row there of injections would be 1 unit each. So at a 2-to-1 dilution, every click, if I was using Jeuveau, would be 1 unit of Jeuveau. So again, I'm just 2 clicks on this upper row, 1 click on this lower row. I typically do a lot of my frontalis muscles, especially that top row. I'm probably going to go a little bit deeper, and then I probably will go a little more superficial on that second one. Squint your eyes real tight for me. Amanda doesn't have major crow's feet, but one thing with Amanda that I do like to kind of point out is she tends to have a pretty dominant cheek over here. I don't want to make her cheeky or shelfy. No elf on a shelf with Amanda. You know, we want to make sure we avoid that. So for her, when I do her, I always like to give her a little bit of a brow lift because she tends to like that. So I'd probably do 1 unit and 1 unit of if I was using Jeuveau, or 2 and 2 with Daxify, because I typically double that dose. And then just to soften her wrinkles around here, I would do, you know, if I was using Jeuveau, 4, 4, 4 and 4 there. I tend not to treat her much under here. I did treat her there once before, and I thought she got a little too shelfy. Her pictures kind of started to look a little wonky there. So, and I like her, so I don't want her to look wonky. Now, if it were somebody I didn't like, shelf away. But you know, we won't do that to Amanda. And that would kind of be my mapping. So I would go ahead and put these marks on there. I would scan it, put it in there, put my depth that I'm going to do, how many clicks I would do in each spot, scan that into my patient's chart, and I would have a perfect pattern to do for next time we're in the treatment. So I'm going to go ahead and get our tox drawn up here and kind of show you how that works. We did, I think, Daxify on you last time, right?
So
We'll stick with Daxify then for today, since you had that last time. I'll take a video too when we're done here today. I'll make a video that I can send you guys. I'll post it on Instagram tomorrow. I can do like some lower face Jeuveau on her, so we give everybody some love today on products, and we can show that. But I like to do a lot of lower face talks as well. But when I'm drawing up in here, again, I've just got my, so I like to drop at a 1-to-1 dilution. That's my personal preference. So I'm going to drop 1 cc of saline, put that 1 cc of saline kind of here into our vial, kind of mix that up. And then I'm going to show you here on screen. I have my little vial adapter here in my hand, trying to work backwards here, which, like I said, I'm bad at math and I could never be a weatherman. If anything's proving that, this is proving that today. And then this vial adapter just kind of, I like to push it on here real firmly, and it snaps in nicely. So I have my toxin there. I very gently invert it. All of the NavaClick syringes come with a little protective cap on the top there that I'm just able to remove, so this stays sterile. This just kind of pushes in. If you ever worked in the OR, it's kind of like the vial adapter they put on propofol to drop propofol, you know, so you have that valve in there. The NavaClick syringes, the bottom of the syringe, what you're going to do is you're going to unclick it so they're not parallel. This then gives you free range to withdraw your medication into the syringe.
Kyle, add some air to that syringe.
Yeah, I
I
gotta
mean,
add some
to the
air there.
vial.
I'm just noticing. Yeah.
Yeah.
Just
Yeah.
noticed that.
And I don't know about you, but I love those vial adapters. So I stick them on my saline too. So I never use a needle anymore to draw up. And I just,
Oh,
I'll use the NavaClick syringe and I'll just pump a few more, air from the NavaClick syringe into it. So I don't even need another syringe or another needle. So I think that helps save cost as well.
Julie, I am doing that tomorrow. I am
Oh, goody.
so glad we did this.
Good,
Now
you
I'm going to
taught
use
me
one of
about
my,
the alcohol and the dry erase, and I taught you about that. We're even.
I am putting a vial adapter on top of my, so
Oh,
here's
there-
my vial here. So I'm going to draw back my tox.
And what Kyle didn't show everybody that's so important is go back and forth a few times so you get that air bubble out. If you have a tiny air bubble in there, your needle you'll waste drops. So it's easy to make sure there's no air bubble by just going back and forth and back and forth. What about you, Dr. Keller? Have you noticed that?
Yeah, you can't have any air in there. Air's got to come out.
Yeah.
So like I said to you guys, I like Julie, I think Julie, you do a lot of 1-to-1 dilution, right?
Yeah.
Of your neurotoxin.
Yeah, mainly one and two. Yeah, if I need more real estate, I'm going to go with 2.
Yeah. I would see you get more diffusion into soft tissue.
But I like
Yeah.
that precision of 1 for most areas.
Yeah.
But-
I'm a big, if I'm using like, if I use Jeuveau, I tend to use 2-to-1 because I like the 1 unit per click. If I'm using Daxify, I do 1-to-1. And then like you, I'm excited. Dr. Keller will tease us some stuff later here tonight. But so again, I know I have my Daxify loaded up in here, 1-to-1 dilution. So again, I'm able to look at my cheat sheet that comes in the NavaClick booklet. And I know at a 1-to-1 dilution, every click on the syringe is going to be 2 units of Daxxify. And I'm going to I want to kind of hold this up to my microphone. I'm going to put the medicated syringe down here for you guys real quick, because I know when I'm injecting, I'm going to hold, this is I'm going to zoom out a little bit here to camera angle. 1, let's go to 2 here, so you can hear. I want you guys to see if you can hear the click. You guys tell me if this comes across, but this is just a demo syringe with some saline in it, but this is the audible click that you will hear. You can barely hear it. I don't, is it?
Put it next to your laptop. Oh, there you go.
I have my headset mic on.
Oh.
They can hear it in the room. I need I need a sound effects guy on the next webinar, you guys. It's got like but you do hear this audible click, you guys. I have a headset mic on, so my voice carries better. I need like an ASMR microphone, I think, next time. NavaClick could have an ASMR channel on YouTube. But so again, if I'm doing this, and again, you'll notice I'm able to talk to you guys now. So again, I'm going to do 8 units per site on her. So 4 clicks. But again, the way this would go is I'm just able to kind of talk to Amanda here and work, and I'm able to just hear my clicks there and deliver them. And I know exactly where I'm at. I'm not having to look at my syringe at all. I'm able to really kind of talk and focus on her. And everything is super easy peasy.
And that's real Daxxify?
Huh?
That's the demo. That's real Daxxify. That's not the demo.
Correct.
Kyle,
She's doing great.
asked how long that needle is. Can you look at the
How
needle?
long is this?
It's less than a half inch, so I'd say
Yeah,
maybe
a
5/16.
third, something like that. Yeah.
How long is it, Dr. Keller?
It is.
I think it's like 5/16 if I.
3/8.
Oh,
3/8 of an inch. So we get a very nice, precise treatment there with and it's very, very comfortable. How you doing, Amanda? Good. Any questions, guys?
They want to know if it's going to be recorded for later.
Yes. Right? They'll be able to get a replay, correct?
Yes, they will.
Okay.
Can you
Any
bleep out
other-
my
any
bad
other-
word that I said earlier?
Huh?
Just
Even the bad word you said early, Julie.
yeah,
You're
they'll bleep it out.
Who cares about a little bad word every now and then?
Yeah, I guess so. Yeah, so Kyle, just to be clear, you put 1 cc into a 100 unit vial of Daxxify, right?
Correct.
So if it were equivalent to Jeuveau or Botox, you would be essentially a 2 ml dilution.
Right.
Correct. Yeah. I think that's where people get confused is there's so many types of unit measurements. No company has the same measurement quality. I mean, measurement, what's the word? The test where they measure units is not ever the same. They all have their own. So it's confusing for people that are trying to get an equivalent when they're first starting out with a new toxin.
Right.
I pretty much treat Daxxify like I would 50 units of Botox, honestly, or 50 units of Jeuveau.
Yeah.
So I put a half cc in my vial of 100 units of Daxxify, pretending like it's 50 unit vial of Botox. So yeah, that's what I like here. Just to get a different viewpoint. We don't have to do it.
And that's the beauty of the
art.
system. I'm gonna zoom out here so we can chat because you guys can see. I'm able to chat and talk to you guys because I'm just audibly hearing my clicks here. Like I said, I'm delivering 2 units per point on this lower row, so it's just 1 click. But I'm able to have a conversation with the patient. I'm able to talk to you guys. because it's just, I don't have to focus on my syringe volume anymore. I'm able to do these other things. I'm able to talk to, I could be asking Amanda about her day, and guys, I'm not getting drips. I'm not getting waste. Like Julie said, I tend to pause for a couple seconds after my last click just to make sure that any pressure that's in there from that kind of ratchet mechanism that's in the syringe has absorbed, that tox has been able to diffuse into the tissue there. But I don't get drips, I don't get wasting. And again, Amanda, are you even feeling this much with yeah, every once in a while they might feel a little pinch here and there, but I kind of joke with them and I say, again, there's a needle going in your skin, so you're going to feel a little something, but it's very
Julie and Kyle, Julie was talking about different ways to dilute and those kind of things. We chart by clicks now. We don't chart by dilution anymore, or units, and so we know exactly how many clicks we're pulling up on our syringe, and I think that makes it a little bit easier. And I want to ask your opinion on this too, because I think there's a little bit more what we found when we launched this. There's a little bit more of an adoption. I wouldn't call it an acceptance problem, but an adoption problem. And I think what it takes is at least 10 to 15 patients in a row, not going back and forth between the other techniques, to really get it in your head as to how it works and how it works for your dilution or your way you inject. And then probably another 20 before you feel like you can't ever do it without it again. Would you agree with that?
I was hooked at the first syringe, but my team in Redding, California, I think we're all creatures of habit. And we initiated one way years ago, and we've been doing that way for years. And I think it's taken them a little longer to adopt than I did, to be honest. I think, we have these wonderful trays that we get there early. We load up 1 ml syringe trays and 2 ml syringe trays. And that's just what we've always done. So it's easy just to bring their tray in there, get the dose and go for it. So I do think it can be a little harder to get out of the old habit of whatever your process was. To change the process is often frustrating for people. But I hope that every single person in my practice sees the value of this like I do. But it's art. Like I said earlier, it's such an art. So if they feel for some reason they're resistant to change, I probably need to work with them a little bit and get them used to it and get them confident. But I want to mention this. We have an injector in our practice with a trimmer, and that injector absolutely loves these and won't use the old way anymore. And I asked how the tox scheme's going, and they said, "Oh my gosh, my precision's so much better, and I feel a lot more confident." How many times have we had too much caffeine, or the tape is rolling and we get nervous and jittery? Or gosh, we have a really tough patient or a little nervous. I think this is so much better if you have any sort of a shake or a tremor.
Absolutely. And I feel like there's so many different training tools and stuff that they're able to offer you at NavaClick. Like there's these little training kits. I use these when I'm out, or if you want to ever just try it, if you're at a conference, they'll have them there. There's a little tissue sample in there. There's these demo syringes. I do recommend get one of the demos and kind of play with it so you can hear that click. I do think when you're playing with the demo, make sure you load it with some water or some saline or something so you can get that pressure in there to kind of practice what that feels like, but you'll definitely feel that tactile feedback. But I know, kind of out of respect for time, because I think the three of us could chat for another hour or two on this, but any last minute questions, for the night about anything that we're seeing in there?
Somebody's asking about, is it only a 2 ml dilution only, or will there be others? And I think Dr. Keller, you might be able to talk a little bit about that. I kind of already let the cat out of the bag. I'm so sorry.
Yeah, so it's in the works. The first one that'll be available is on label. It's designed for a 2.5 cc dilution, and it'll deliver 0.025. So each click will go to 1 unit, but you can do your traditional 2.5 cc dilution. And there's plans to have it to make your 1 cc dilution easy as well. All this is in the works, and it's coming down the pike pretty quickly.
Yeah, and I love how they're going to be different colors, so it's still easy. You could still preload if you wanted to. So
But I'll show you guys, if you guys can see it here, these are what those dilution charts look like that they give. So again, like Julie and I are talking here, and probably Dr. Keller, we all might use different dilutions with our tox, but the tools are here for you guys to easily adapt with the current 0.02 ml push that's out right now. You're able to easily adapt that based on what dilution you want to use and kind of integrate this into your practice, because NavaClick has really thought of everything, and they have these charts, you know, and these dilution tables available for you to easily implement this with whatever you currently use and how you like to dilute.
So also with your first purchase, you will get one of those non-sterile demo kits, and you'll be set up for a virtual training. And it's really important to do the virtual training. It'll make your whole experience so much better, so much easier. It'll reduce your frustration levels. It just makes, this is what we've learned to transition people into it. It just makes a huge difference. And then I don't know if they have the QR code, but there is, for participating in the webinar today, there is a discount code for your first purchase. And if you already are a customer, you just call customer service and tell them you were on the webinar.
also, all of us, I want to point out that all of us have adopted this this system without somebody paying us to do so. I promote these all the time, and I'm not being paid. I really feel like that sets us up, sets it different. It makes it more honest. If I'm saying I love something, it's because I really love it. And all it took was Howard giving me one, and for me to try it, for me to just sing the praises. So I just want to say that, you know, I'm not I don't work for this company. I just absolutely love it. And I'm not getting paid to promote it out on my social media or on Patreon. I just really, really like it.
And
Yeah,
I'll tell you, they make me pay full price, just so you know.
Yeah.
I'm
the same way, you guys. Like,
it's the same way that you are.
Like Julie, there's not a financial benefit for me to be here tonight. It was an honor to be able to collaborate with the team here and put this together, because I think Julie and I really come from a place of authenticity within ourselves, that we wanted to share this. We wanted to talk about how great this tool is, and investing this little bit in your patient delivers such a better outcome and patient experience. And those are the things that are important to share.
Yeah, I hope you guys love it as much as we do. And somebody says, how do they get a demo and a rep in their area? I think starting at NavaClick.com, is that what they should do?
Yes.
Okay. And
Yeah.
yeah.
Julie and Kyle, I can't thank you enough. This is my first webinar host, and it was just a delight to be with the two of you.
Thank you. And thank you so much to Empire for hosting us tonight. You guys have been fantastic to work with, and a flawless system there. And again, it was such a joy. And everybody attending, thank you so much for watching and tuning in. You're taking times away from your family, your practice, your anything other commitments you have. It's really appreciative that you did that. And I hope that you find this, you know, nifty little clicker as helpful as Julie and Dr. Keller and I have, and that you're able to bring this to your patients to really kind of bring them the best clicking experience they've ever had. I'm going to keep coming up with tons as much as I can. You know, we'll come up with as many as we can, but
love it. I love it.
All right. Thank you guys so much. We really appreciate it. You guys have a fantastic evening.
All right, good night. And y'all have a great holiday season.
Thanks, guys. Have a good night.
Oh my.
Happy holidays.
Bye.
Holidays. Bye.